Hi, good evening. Thank you so much for being here tonight and for joining us for these updates and progress that we have been making at the department over the last month. I'm really happy to be back with you tonight and really to give you some of the updates, share where and how we have been working hard at the department to provide resources to the field and also to build some of those systems you all have been anxiously awaiting as we worked on our strategic plan prior to COVID. I want to encourage you, if you do have questions, we will cover a lot of information here tonight. So if you do have questions, please feel free to put them in the chat. We will try to answer as many of them as we can. I won't necessarily get to all of them, but we'll make sure to provide updates afterwards as well. As we look to the materials for tonight, a reminder that this recording of this presentation and the materials will be available online after the meeting. But wanted to start with a few general updates for you all as we look at the what we have done over the last few months. So as you all know, we have been working anxiously to provide some critical resources to the field and to our providers during this time. And so in the last few weeks, hopefully you've all seen this in your emails, but we were able to launch two really critical resources to our providers to stay safe and healthy and to make sure that they can remain operational during this really critical moment in time. So the first, we were able to launch free COVID testing in partnership with philanthropic partners. We are able to start a free pilot that we intend to sustain and support and scale as necessary at the state level. This testing is available to all childcare affiliated people, everyone from providers, family members, and families and children using the COVID test sites, using your childcare sites. So as you will remember, that the reason for doing this was that we were seeing some critical gaps across the state in access to testing that could make sure that providers could get back to work and children could get back to care as quickly as possible. I want to make some really clear information around what this means. You can still use all the Stop the Spread sites and all of the testing resources that have been available for you throughout the entire, throughout the COVID pandemic. However, in those places where we were seeing gaps in access and gaps in access for children under 2, these sites are dedicated just to those individuals affiliated with childcare to ensure that there won't be long waits and you don't have to make an appointment beforehand to make sure that we are able to get you test results very quickly. These test results would be used the same way that you are using the Stop the Spread test results. It doesn't change the protocols laid out in our playbook of making sure you are quarantining and isolating as necessary and abiding by all the recommendations from your local Board of Health or your local epidemiologist, or our epidemiologist, state epidemiology line. However, this testing can be used to make sure that you can go back to care per those protocols. We want to make sure you know these testing sites are free, but you don't need an appointment, but you do need to register. The registration is how you'll receive your test results, and they can help you at the site to register if you haven't been able to do it before you show up. It will ask you for your insurance information, and that is how we are defraying the costs, as by charging insurance when appropriate, but there will be no cost for you and there is no copay required. And if you do not have insurance or the family is utilizing your care do not have insurance, it will not be charged to them. We also wanted to make sure that you knew that there was a a couple glitches on the very first day, and so if you heard about a couple delays in testing given the snowstorm and some shipping challenges that were had, those have been worked out, and we are seeing a 24 to 48 hour turnaround for all test results now. So wanted to make sure you knew that that was happening and fixed, and we were able to move forward. If you are interested in more information, the QR codes on the bottom of the page will take you to the site that will give you more information if you point your phone at it. Secondly, I wanted you to know about the supplemental PPE that we've been able to provide providers as well, to make sure that we were hearing gaps in availability for PPE, and wanted to make sure that our providers had the resources that they need to stay operational, keep themselves and their families healthy. And so we have had over 2,000 orders placed, and we want to make sure that that you know some of the details there. We have been able to increase the communication from the vendor. Want to make sure you understand what this is. This is a vendor that has been procured and supported by EEC to provide resources to our providers. And so in that way, communication from the vendor to our providers, let them know around shipping and ordering. And we have heard that there were some gaps in that communication and have increased that to make sure that people are getting the information they need quickly. But we appreciate your patience in that and know that this is such a critical support that everyone needs to make sure that you can keep your programs operational. And so please, if you did have trouble in the first round, please do please make sure you let us know, and we'll make sure the vendor reaches out to you. Finally, I know that there are a lot of questions around the COVID vaccine and the application for our workforce. So I want to, again, you have the QR code that will take you to the details. Please do know the DPH and the command center do keep these details up to date and often provide up-to-date information at the same time that EEC may get it. So I just want to make sure you know to keep checking that website, keep up to date, and we will distribute the information. But you should not, you should know that DPH is your best resource, and that COVID-19 website is your best resource for the most up-to-date information on the vaccination. Our principal planning in for the distribution of the vaccine for Massachusetts has really been to focus on those individuals and communities that are most at risk and hardest hit by the pandemic. So childcare workers, childcare and EEC workforce are in the phase 2, which we really do hope to begin soon. But right now we are constrained by the supply of the vaccine received from the federal government. At this time and for the foreseeable future, the state receives just enough to continue the rollout as planned, and we will keep you up to date as we get additional information. We are rapidly building capacity across the Commonwealth to offer vaccinations without delay, and to make sure that as the supply increases from the federal government, we are able to expand the distribution quickly as well. For right now, I want to urge you to get connected to your medical provider, your primary care physician. Make sure they have all the update information, and make sure that you that they are prepared and know how to get in touch with you when they do get access to the vaccinations as well. Finally, if you don't have a primary care provider, we encourage you to get connected with a community health center. It is always best to get any medical intervention from your primary care physician. So getting connected with the medical home will be the safest way to make sure that you have access to the vaccination. Make sure you're signed up for the commissioner's emails so that we can get you information very quickly when we do get it, and make sure you know what is available. In the meantime, we know that one of the biggest concerns is around how the EEC workforce will identify themselves. And we want to assure you that we're working closely with DPH that when the vaccine is ready to roll out to our phase, that we will make sure that we have the appropriate instructions and that there are no barriers for our workforce just because you don't have an ID that says EEC. So we will make sure that all of that is in place and we are actively communicating about it and eliminating any barriers in your way to getting the vaccination. Now I want to move on to some of our future planning. As you all know, there is a desperate need for funding in the field to keep our operations. We have 83% of our providers from pre-COVID that have come back into the field. But we want to make sure that we maintain that capacity, and despite fluctuations in enrollment that we're currently seeing, that our providers can be stable, secure, healthy, and safe for families that need them throughout the recovery. So we want to talk a little bit about our path forward there and some of the work that we've been doing with the state budget and the federal stimulus funding that has been coming to EEC. When we first entered the COVID crisis, we already knew that the field was in a fragile state. We knew from, and we talked through our strategic planning about the fact that the field was needed to build stability prior to even enduring a pandemic. This is in part because of that per child business model that requires maximizing enrollment just to make ends meet in a program. And we know that given with COVID, that enrollment is fluctuating and costing more just to maintain the same number of children in your care. And this means that when you are looking at supporting budget expenses like staff salaries or rent, mortgage, utilities, other fixed costs that don't actually go up and down depending on the enrollment, it can make it really difficult to be able to support your infrastructure during this time. The fragility in this business model has really left us in a precarious place as a field, and we want to know we want you to know that we recognize this as you faced new health and safety requirements, as you saw as you've been seeing family demand go up and down based on community transmission and numbers and COVID numbers, and based on what school districts may be doing in your community and what kind of services they may be offering. We need to make sure that we have a solid, stable business structure that can sustain itself through these fluctuations in enrollment that we intend, that we expect to see for the next year. In the face of these questions, one of the real impetus that we keep talking about is how do we build back better? How do we do things differently than we have in the past? And how do we anticipate that enrollment will continue to fluctuate, but also come back as the economy recovers and shifts? And really, when we look at what business and what employment will look like going forward, we'll need to react and prepare for that reality as well. With this in mind, we are looking towards our investments over the next months that move away from a per child funding model and to support your cost of operations that is to ensure a sustainable model. We have to find new ways to finance this business structure if we're going to make sure we can recover stronger and more effective than we went into this COVID crisis with. We're closing in quickly on these strategies and the details on how we can deploy the funding, but we wanted to make sure that we were highlighting some of the information you can expect to see in the next weeks. First, when we look at the FY21 GAA budget, that is the General Assembly Appropriation Budget. That is the budget bill that passed from the legislature and was signed by the governor to be able to appropriate dollars to EEC to spend for the current fiscal year we are in that ends at June 2021. We're looking at two strategies here that will really focus on how do we get the funding to those, that workforce, those people who've been showing up every day, caring for our children and making sure that we have stable, safe, healthy programs. We'll look at for our center-based or GSA programs, looking at workforce investments that will prioritize things like hazard pay and expanded capacity you need to be able to operate right now. And really thinking about the family childcare investments that will look at how we can invest in the program so that our family childcare providers don't have to spend their own salaries on investing on health and safety measures. Both of these strategies will begin to move us beyond that per child funding approach and begin to test models as we did with the CARES Act of trying to identify what kind of strategies we can employ over the next year that will make sure that we're sustainable and that we are maintaining the investments in our workforce that will be so critical when we come to the other side. Then we are working with the legislature and the federal government around the federal stimulus funds. A couple things I wanted to point out here. First is that this has to be appropriated to EEC through a supplemental budget process in order to be allocated and spent. So we'll have to go through the budget process and then we will be able to spend those dollars. That doesn't mean we're not planning, but I wanted to be realistic about what the time frame and the process is and what kind of decision makers will need to weigh in as we get the dollars appropriated to us. The federal direction does include language that requires this funding be accessible to all providers, and it does include language that we provide funding to those who have not previously received funding. So we're working closely with the legislature and the administration to follow this directive and identify ways that we can deploy the funding into the field quickly, efficiently, effectively, without a lot of burden on you all, and with making sure that we have the capacity to implement it smoothly at EEC. We will be looking again to really thinking about mitigating the impacts of that enrollment fluctuation and recognizing the increased expenses that everyone has taken on to operate under the COVID environment. We'll continue to engage and be thoughtful on this. And if you check out our engagement portal, you'll see that there's some upcoming webinars, and we look forward to bringing you some of that information and ensuring that we get your feedback along the way on how we can implement that. All of this really does lead us to prepare for a different future. We can learn from these grants, reconsider how we finance and think about the early education and care field, and really make sure that as we progress through FY22 that begins in July, that we're ensuring that our future investments are strategic, supportive, and can really help build a more sustainable field that will be available for families, supportive to our educators, and ensuring that children get the services they need to really transform their lives. All of that is to say that that financing strategy is a critical component of the work that we already had underway at the department. And I want to make sure that we're hitting on with you some of the information that we presented to the board about the details of what those strategies look like and what kind of milestones and initiatives you can expect, and progress you can expect to hear across these initiatives over the next months. A major part of this, and I think a missing part as we discovered evaluated the strategic plan, was to make sure that we did have that financing structure. With COVID, with the federal investment, we've had an opportunity to really think quickly and about how we deploy a different financing, but we need to make sure we have the systems and structures in place to support providers, support educators, and support children and families to access those services and ensure that we are removing the barriers to sustain and stay in the field. We really view that as a foundation for our strategies, but the success of all the work we do requires all of us, all the elements as a system, to do everything we can every day to prioritize not only how we stabilize the field, but also how we build back the capacity in a way that will help meet the new reality for families and the new landscape across our communities. So I'd like to start the conversation about programs with our program pillar of our strategic plan, and really looking at some of the preliminary work we've already started on engaging the field on licensing regulations. Licensing regulations are really the foundation for program quality efforts. And as many of you know, in Massachusetts, our licensing regulations are some of the most rigorous in the country, really put us at a level, our licensing at a level above and beyond what many QRISs have been able to achieve in other states. We're at the early stages of redrafting our licensing regulations as we speak, and making sure that they can really adequately serve as this foundation for quality, as well as making sure that we are able to reflect the different types of programs accurately and support and build networks of support based on program model. We hosted meetings in January and sent out surveys in December and January to get early feedback on existing regulations to find out where the biggest pain points were and what kind of work we'll have to do to be able to restructure them in a way that makes them clearer, easier, and more of a foundation for all of you. This feedback serves as a great landscape on where we should focus our efforts and dive into the first draft. And the next stage of engagement on this as we head into March and April, moving back to the last slide, as we look into March and April, we will start to ask more specific questions about changes we're making and help us understand choice points, decision points, and making sure we're not setting anything up for unintended consequences along the way. Ultimately, we hope to have new regulations in place to begin by the end of summer in a way that we will be able to continue to support programs and implementing them over an appropriate time frame. As we said during the strategic plan, we will never expect that people meet new regulations immediately, but are taking much more of the federal approach where we'll look at milestones over the course of implementation that will get us to full implementation over time. I also want to highlight this continuous quality improvement planning. For many of you, you know that for our QRIS this year, we are not asked, as we transition away from the QRIS, we are not asking you to apply for a QRIS level in the way we have before, but we are asking that in order to qualify for the benefits of QRIS, that you work through the continuous quality improvement planning process and have that on your as a guidepost for your program quality improvement efforts during this year of transition. This reflects our belief that quality is really more of a mindset than an outcome. That we're really looking for a mindset of continuous quality improvement, of how you actively engage with your data, with your planning, with your educators, and how you look to support and understand your program to make the right kind of investments of where it can be most impactful for quality. As we move to this new approach, it's more important to us that programs are engaging in the process of improvement than just checking the box that you've done everything on the on the QRIS application. I want to assure you that all of the work that anyone has done on the QRIS will absolutely not be asked to redone at all. And part of what we're trying to do is reflect the extensive efforts all of you have done, not just as a one-time QRIS rating, but as an ongoing quality improvement process that you're all engaging with every day, and reflect that in how we honor that process. We'll have scheduled sessions of this for next week, as well as both surveys for both family childcare and center-based programs to give feedback on our direction of our quality efforts. You can visit the link on this page at the bottom to register for that session or to take any of the surveys. We also want to make sure that we are supporting the field with program supports that are meaningful and responsive to the new kind of program you're all offering during COVID. This means that we really need to not look at expensive monitoring systems to identify how quality is working, but really invest in the kind of ongoing coaching and collaborative supports that will allow programs to be supported in that mentality and that process that we are hoping to reflect. This does mean that we will look to redesign our program supports and to really ensure that they are responsive to the needs of the field during COVID and beyond, and be able to support programs of every type as they engage with quality improvement. These supports, of course, include the ones that many of you have been accessing and have already made so many pivots to try to be responsive to the new type of program dynamics we are seeing during COVID. But they include the professional development centers and coaches, early childhood mental health consultants, and the early childhood support organizations, which have just launched their first pilot, and really making sure that we are investing in the kind of supports that can drive that quality improvement process. We also want to make sure that we are very intentional about how family childcare are supported as a unique setting for early care and education. One that is experiencing program loss before COVID, and as we head through COVID recovery, we'll need some intentional ideas, strategies, and infrastructure to be able to sustain this really critical resource for families. This means reviewing our policies, our regulations, and our supports that are specific to family childcare, and identifying where we need to pull out specific structures to meet this very unique model. We want to recognize and support that the family childcare educators have very specific needs. The ways and structures for collaborating look very different than they do in a center-based program, and we want to make sure that kind of structure can still impact the educators and still support educators in this model. We also want to invest in leadership and business skills of our providers. We want to make sure that when we look at financial training, that as we are deploying funds into the field, we really want to make sure that you all have the skills, the resources, and the training to be able to accurately and effectively deploy that to support your business. We know that many of you got into this business because you love children, you love working with families, and you know the impact we can have when we do this work well. You didn't always get into this business to try to figure out how to manage a complex budget, and want to make sure that you all have the support you need to try to figure out these skills if you haven't had the training in them. So we'll be building cohorts to be able to support all of you in being able to access these kind of academic resources that can give you the training and skills you need, and make sure that all of our programs are equipped for the new landscape that we will encounter in FY22 and beyond. Want to move on to our educator supports. So obviously, wonderful programs only work if we have wonderful people in them. And so that is a core fundamental approach to our strategic plan. And as we think about how EEC supports and considers educators, we've really been in the process of trying to build the systems that will help us accelerate this, the workforce pipeline as well. I want to start with our background record check process. We have been in the process of rebuilding and revising the background record check system, which started with our regulations, which we revised this summer, and have also and have finalized and put out that fix some of the challenges people were having. But we also then need to drive to our policies, our protocols, and mostly our operational systems that are supported by new technology. We know that our operations systems have to be revised, have to be refined, and have to be invested in order to ensure that our very skilled background record check team is effectively set up to be successful on behalf of our educators. We also know that ultimately that is going to take a new technology that is organized around the person as opposed to the program, that a person is able to support and access the information they need on the technology and be able to facilitate their own engagement with the background record check system at EEC. So ultimately, we're targeting a more fluid system that is integrated and a foundation for our educators rather than a barrier along the way. So we will continue to work through that as well. We also know that in order for this to work, the background record checks is just one portion of it. If we're going to figure out how to support a pipeline of educators, we need to capture who and where are our educators, and how can we ensure that that we are tracking progress on their behalf. We need a strong system to support all of this work. We need a professional registry, a database of our individuals to make sure that we are capturing information and mostly supporting them in accelerating their own professional development and supporting programs to differentiate the work across educator competencies. I wanted to highlight here going back to the last slide. I want to highlight here that we, as we look at all of this, that going back to what we talked about during the strategic planning process. During the strategic planning process, we talked about the fact, and I continue to run across educators, even our own licensors in conversations who've had a myriad of experiences before being in the role they're in now. When we look at this, one of the things we see is when your job certification or credential is defined by the role you're in, we have a challenge helping people facilitate the increasing competency that they're gaining and validating across different roles that they may play. So the registry is a foundation on which we will build the educator credential. And that credential will make sure that we are validating and supporting the emerging competency that our programs our educators are gaining through experience, through professional development, through coaching, and through higher education. And when we do that, we'll make sure that this credential is transferable across jobs and roles, is stackable so that you can increase your expertise and make sure that that ladder validates that expertise and experience that you're gaining through time in the field. So you finally won't have to start from scratch each time you move jobs or locations. This is going to be a long process, but one of the things that we wanted to highlight is that these foundational components that we're starting are really building blocks for a much longer, much more robust and much more supported longevity of the workforce, so that we can actually validate and support people to stay in the EEC field. And as part of this approach, we are starting to think about where and how regulations need to work in this space. Right now, we have many professional qualification regulations worked into our program regulations, which makes it hard for us to support a workforce independent of where they may be working at the moment. So as we move through this, we'll be looking at making sure we're specific on licensing childcare spaces, but making sure that our people have access to a credential that can grow and expand with them. So what are the rules that govern people in the field? This is what we'll be determining over the next months. How do we evaluate competencies in a way that helps employers determine what is qualified, what is a person's qualification on what they work for, specific populations they may have expertise in, specific roles they may be well suited for. We want to provide some EEC validation so that that is transferable and helps professionalize people as they move from job to job. We have engagement surveys and surveys and engagement webinars planned on this topic over the next month. So please do register for the educator credential sessions using the portal at the bottom of the page and make sure that you have your voice as part of this process. Finally, looking to family access. So ultimately, all of this work and why we are all here is to impact children and families. So we want to be able to ensure that they're able to access the early education and care experiences that you're all providing, and that they're able to that we're able to help children and families fulfill their potential both for now and in the future. And in many ways, this really does require robust community collaboration, where there's no wrong door for families and where we all are on the same page around what it is that children should know and be able to do, and how parents need to be supported to help them along the way. When we build strong collaborations, we can really accomplish so much more on behalf of children. And one thing we need to make sure we are doing is that we're tracking how they stay on track to third grade success. We can build a shared understanding of what on track means with the indicators that tell us how are they doing and are they in the context that they need to be supported in the development that we hope they will have in the early years. And once we have that shared understanding, we really can help build the community infrastructure and the family supports and really result in making sure children do start and stay on track to success for third grade and beyond. Finally, a critical part of this is really around affordable access. So we know that that we need the community infrastructure, that everyone knows about all of the work that's happening in each other's programs, that we can help parents find the resources they need, and not everyone has to be every resource. And we know that in order to do that, we all have to have a shared understanding of what that trajectory looks like. But we also know that we need to support our programs. We need to support our programs to be affordable and accessible to parents. So that has a few different components right now. Obviously, looking at our subsidies, and we'll talk a little bit about parent fees in a moment, but looking at our subsidies to ensure that they continue to be accessible and affordable to families that don't have other access to childcare. But also, we need to do some work looking at what the future will hold for us. The parents' needs are changing rapidly right now and will continue to change over the next couple of years as we head through recovery and beyond. And when we do that, we need to look and see what is it that we think families need, and how do we help provide that information to the field so you all can respond and build those collaborations that really help meet the new, unanticipated, and unexpected needs that families are having now and beyond. There are so many families and programs that don't participate in the subsidy system, and we know that as well. So we want to host a conversation on March 4th around some of the financing that will look at how we will consider some of these, the balancing the parent needs and the financing of program operations as well. So moving on to the next slide. Excuse me. I wanted to highlight a vote that was taken last week by the board, the EEC board, around our parent copay model. There's a lot more information on our website under the board materials. So if you're interested in seeing the data and the analysis and the ongoing conversation we had with the board over multiple months, please check out our board materials for more information. But I wanted to point out, after a comprehensive study that we worked with on the National Think Tank for the Urban Institute, who is the national think tank that works with childcare around the country to look at different parent access questions. With input from families and providers and advocates along the way, and the board did vote to endorse the parent copay model that really is very innovative and pioneering for the country. It essentially exempts any family income under 100% of family poverty level. So family's income, anything up to poverty will be exempted, and the copay will only be charged on the income above poverty level. For 99% of families in our current subsidy caseload, this will represent a decrease in the cost for them. But it also helps with what we call the cliff effect, that early stage when a family goes from paying zero copay at 100% federal poverty level, and that first dollar over was paying a copay on their full percentage by paying the percentage on their full income. By helping mitigate that, we're making sure that we're incentivizing earnings, we're incentivizing people to move up in their earnings without creating an overly burdensome childcare cost in those initial brackets. Finally, it also brings us into alignment with the national recommendations about our subsidies as well. It's innovative, and I have to commend the teams that did a ton of work to get to this place. But more importantly, it also recognizes that families will be facing significant financial constraints in both the near and long term as we move towards economic recovery. And that access to childcare is both a critical part of both rebuilding a family's financial stability as well as the financial stability of the Commonwealth. Important that our public comment for this, for implementation of this fee scale will begin on Thursday. And you can expect to have, we will be having some public hearings in the upcoming weeks and months. So please do stay abreast of that engagement through our engagement portal. Okay, moving on. Excellent. So we've been talking a lot about engagement, and I have been encouraging you to go and have these deeper conversations on the issues and topics you may be most passionate about, most invested in, or care most about the changes we're making. You've heard about it in this presentation. You've heard about it in previous ones. Maybe you've enjoyed our regional town halls. But I wanted to explain a little bit more about what it looks like when we are doing this engagement. Engagement is not just about EEC sharing with you. It's really about us gathering your feedback and at milestones along our process so that we can do something with what you're sharing with us in our decision making. The point of this engagement is to turn EEC into our continuous quality improvement process as well, that we are taking your feedback and integrating it into our work on a daily basis in real time, that we are making iterative changes that are part of our continuous quality improvement process to support you. I wanted to make sure that you knew in seeing this where you could get information on both sides, where we are communicating out and improving our systems of communication, but also where we're working to take information back from you and integrate it in. These questions, these surveys, this process is not just about weighing in on a survey, but it's us providing critical questions that are informing our next steps. So when you see a product, when you see a draft, when you see something we're bringing to you, we can tell you what kind of feedback we got along the way that got us to that draft. It makes the process longer. It makes the process more diverse in terms of the voices we have at the table. But I think ultimately it gives us a stronger product and a stronger change that will help us really build back better. So we want to do this together, but we need you to take advantage of the opportunities we have to do so. So moving on to the next slide, some of our upcoming engagement opportunities here you can find on our strategic portal, but wanted to make sure you have these front and center in front of you. The live engagement opportunities start next week, and you will see feedback sessions on program quality, educator regulations and support, financing models, family and community supports by age group, as well as looking at our initial thinking on our subsidy regulations. I also want to point out that the live engagement sessions are interactive. I know this is a little bit of a different way of doing engagement for EEC, so I wanted to highlight what you can expect. We've gotten a lot of feedback that when people heard it wasn't anything that they had experienced before. So we wanted to let you know and encourage you to come and be part of this process. There's information, of course, there is information sharing as a portion of these that will explain and update on where we've either heard feedback from you, a direction we're going, initial approaches or thinking that we've taken. But then we have dedicated time to just hearing what you have to say and understanding the reactions you're having. We ask real-time questions that allow you to provide real-time feedback. And we use a software called Poll Everywhere that allows you to participate right there on your phone or your computer and give us the kind of real-time data that we need and allow for a dialogue across many stakeholders simultaneously in a real aggregated way. It's a really cool technology. And if you missed a session, you weren't able to attend one yet, you can absolutely find the recordings, and then you can provide us the feedback through the surveys, through comments, as well as through the subsequent sessions. You can also find the results of all of the surveys that we've done from December and January on the portal. So you'll see all of those in a way that allows for transparency and dialogue as we are building these systems. So I wanted to highlight that because as I know things are moving fast and as we have this real integrated strategy to make sure that we are building all of our systems, we also wanted to make sure that you knew the place and the avenues that we were really gathering and integrating your feedback, your perspective, and the perspective of the variety of different stakeholders that engage and rely on EEC along the way. Please take advantage of these. It really is, as any of you who have spent any time with me so far know, that I'm an active learner, and these sessions are ways for us to actively learn about experiences that are rapidly changing on the ground. So thank you in advance for the time you're putting in to inform this, and thank you for showing all of the highlights, the successes, and the frustrations, so we can make sure that we're in our continuous quality improvement process as we support you all through yours. Now I know that there are a few questions, I'm sure, and so I will pause for a second and allow some of those to be asked.
Thank you, Commissioner. I think we have gotten a lot of comments, especially in the beginning as you were talking about PPE and testing. And people have commented to say, I received my first shipment, and thank you so much for this supplementary PPE. We also had some comments saying, thank you so much for adding testing sites. And so a lot of gratitude has come through in the early moments of the presentation for those efforts. So just wanted to sort of acknowledge that.
And to know, I know for all of you, this is something, a critical need, and we will continue to try to meet these. And thank you for all of the work that you're doing every day.
Great. I think as we have seen questions about thinking towards the summer and fall, and especially knowing that things are always changing, programs are asking what they can expect as they think about health and safety and those requirements as they move towards the fall.
I know this has been on a lot of minds lately, especially mine, and so I'm really glad to address some of this question. I don't have any more of a magic ball than all of you do, and so I don't know, and I can't predict what the public health landscape will look like. What we do know is that for the foreseeable future, even as adults are vaccinated and the CDC continues to update its recommendations, we will still be asking that we wear masks in alignment with these recommendations, that we avoid group settings. And so for the foreseeable future, we will still have to practice many of the same health and safety practices that have been in place. We know that this is really a huge adjustment for you all, and the adjustments that the programs are making. And so we are working to make sure that we have the flexibility at our regional office level, and that our licensors are able to help problem solve and process with you, that our regional directors have the discretion to be able to ensure that you are able to keep safe practices, and regardless of how you have to rearrange some of your program. We have made sure that we were able to return to group sizes, so making sure that everyone knows there's no restrictions on the group sizes and ratios, but do ask that you keep stable groups, and that you make sure that you continue to minimize the number of contacts in a day, for each group. We also have asked our regional directors to allow for variances for the 42 square feet per child if there is a robust health and safety plan in place. So while we won't be moving away from the 42 square feet per child as a requirement, we are allowing for variances to go back to 35 square feet per child if there is a robust health and safety plan in place. So you'll want to talk to your regional office and understand how you can put that in place for your program in a way that can allow for some variation in how you are implementing. I absolutely understand that this is a huge adjustment, and things like not allowing non-essential visitors into the program. And we will continue to try to adjust and allow for practices that maintain health and safety, but are allow for the flexibility that you all need to operate effectively and efficiently. So please do keep talking to your regional offices, your licensors, and your regional directors to help problem solve as we work through this in a way that can make sure that we're able to support you along the way.
Thank you, Commissioner. We also have questions about the vaccine, and specifically if EEC will mandate the vaccine when it's available, and sort of what EEC is able to share related to the vaccine. And I think this is our last question given the time, but if you have anything to share.
Absolutely. I wanted to make sure everyone knows that we will abide by the DPH recommendation. The Department of Public Health is responsible for setting the recommendations for immunizations, and EEC will not be setting those above and beyond our authority. Right now, we are mostly focused on communicating with you as soon as we know more about timing and availability. And there's a lot of resources to help you understand the science behind the vaccine and help you weigh your options. You can also, we showed the link earlier, so you can go to that link to understand more about what is available for you. The CDC also has wonderful resources on the safety of the vaccine. Right now, we are urging everyone to make sure you're connected with your medical professional and stay up to date with all of the emails. But at this point, EEC will not be setting requirements above and beyond our authority, and DPH is who sets vaccination requirements. But as I said, and I want to reiterate, as we talk about the vaccination and as we talk about vaccinations, is ensuring that we are keeping those good practices in place, because the vaccination, the data on the vaccination is strong, and we need to make sure that we are understanding how we can keep people safe in our programs as that is rolling out. And so we need to make sure that you still are wearing masks, social distancing, communicating with parents about the importance of them limiting contact and exposure. And so over the next months, as we look towards vaccination, we will also be looking to supporting you in communicating with your workforce, your staff, your parents, and your children around the practices that still need to be in place as we roll out the vaccination.
Thank you so much, Commissioner. I know we're at time, but we have questions in the Q&A. I think we're happy to stay here a moment and answer some of those, but I know that we need to release everyone back into their lives this evening. And so we will stop the live session and answer anything we can in the live chat quickly in the next 5 minutes, but otherwise, thank you. Is there anything you wanted to add, Commissioner, as closing?
Yeah, I do want to add that I think we want to for our providers who are on the brink of real hardship, who are enduring real hardship, our childcare providers, there is an urgency to some of this messaging of being able to make sure that they are understanding what is changing and what is required of them as we move quickly. I know in the question and answers and in many of the people that that we are hearing from, that is one of a robust network of supports that we have and the Commonwealth has for children and families. And so when I talk about the field, when I talk about our efforts, our work with programs, educators, that is comprehensive and inclusive of all of that network. There is also a need for us to address a real critical infrastructure challenge with our child care and early education and care providers that requires some dedicated attention right now. So I just, in recognizing that, know that there are stakeholders far above and beyond child care providers who are listening and are participating, and also want to make sure you have the information about this critical resource for families, but know that the strategic plan, the work across all of this work, is far above and beyond, and the mission and vision of EEC is far above and beyond just EEC childcare providers. And I wanted to make sure that everyone knows it's inclusive. Our engagement is targeted to stakeholders far beyond that, and hope you will continue to engage with us on that as well. And with that, I will thank you for your time tonight and for being active participants and asking questions and ensuring that we have the resources available to you. Again, I am remiss not to be able to say this every time I talk to anyone, in that I never thought that I could have cared more deeply about this field than I have in COVID, but the passion, the dedication, the engagement of everyone who is caring for children and families across the Commonwealth right now is remarkable and inspiring, and really motivates me to get out of bed and to show up every day and continue to work as hard as I can on behalf of this department and on behalf of the Commonwealth and all of you who are showing up and working on behalf of children and families. So thank you for your continued partnership and collaboration. Please continue to engage with us, continue to help us learn more about how we can help you, and have a great evening. And thank you so much for being here.